Most people assume that if a surgeon recommends an operation, the decision is already made. The doctor knows best. The hospital has the equipment. The paperwork is ready. All that's left is your signature. That sounds reasonable until you start seeing what happens after the operating room. A senior goes in hoping to fix one problem and comes out with 3 new ones. A man walks in with chest pain and survives the procedure, but never gets his strength back. A woman goes in for back surgery and spends the next year fighting pain, weakness, and complications nobody fully explained to her beforehand. A family is told the surgery was technically successful, yet the person they love never really returns to the life they had before. That is the part nobody likes to talk about, because for seniors, the biggest danger is not always the disease itself. Sometimes it is the stress of the operation, the anesthesia, the inflammation, the blood loss, the immobility, and the brutal recovery that follows. Welcome to Wellness Daily. I'm your doctor, and today I want to walk you through 5 surgeries that many seniors should never agree to without slowing down, asking harder questions, and understanding the hidden risks first. Before we get into number 1, give me just a few seconds because this matters. If you care about staying strong, independent, and mentally sharp as you get older, make sure you subscribe, like this video, and leave a comment below. It helps this message reach more people who may be standing one appointment away from a decision that could change the rest of their life. Now let me ask you something. If you take a brand new phone battery and a battery that has been recharged thousands of times, then force both of them to handle the exact same load, do you expect the same result? Of course not. And yet for years, medicine often treated a 70-year-old body like a younger one. Same operating room mindset, same expectations, same recovery promises. But the truth is, an older body does not absorb surgical stress the same way. The heart has less reserve, the lungs may take longer to recover from anesthesia, the kidneys may process medications more slowly, the immune system does not respond with the same speed, and the brain, especially in older adults, can react to surgery with confusion, fogginess, memory changes, or a long period of disorientation that families are never fully prepared for. And I want to be very clear here, age alone is not the issue. I have seen older adults recover beautifully. I have also seen younger people struggle badly after surgery. The real issue is not age by itself, it is fragility. It is how much reserve your body still has when something major hits it. That is the real question. Not just, can you survive the operation, but can you survive the recovery with your strength, your function, your independence, and your quality of life still intact? That is a very different question. And once you start asking that question, some surgical recommendations begin to look very different. Surgery number 1, open heart surgery in a frail senior. Now let me say this first. Heart surgery can absolutely save lives. There are situations where it is the right move, and when it is truly necessary, it can be life-changing. But many seniors hear the words bypass surgery or open heart procedure and assume there is no other road. That is not always true. Open heart surgery is not just a repair, it is a full-body event. The chest is opened, the body is placed under enormous stress. Recovery can be long, painful, and complicated. For a strong senior with good reserve, that may still be worth it. But for a frail older adult with kidney problems, lung disease, diabetes, memory decline, or general weakness, it can become a dangerous gamble. What many families do not understand is this: a surgery can be technically successful and still leave the patient weaker, more confused, more dependent, and less able to enjoy life afterward. That is why seniors should never agree to major heart surgery without asking one simple question first. Is there a less invasive option for someone like me? In some cases, there may be catheter-based procedures, stents, valve interventions, or medical management options that place far less strain on the body. Does that mean the less invasive option is always better? No. But if nobody even discusses it, you do not yet have the full picture. And without the full picture, you are not making an informed decision. You are just moving with momentum. Surgery number 2, multi-level spinal fusion for chronic back pain. This is one of the most over-romanticized surgeries in older adults. A senior has years of back pain, maybe nerve pain, maybe stiffness, maybe trouble walking. An MRI shows degeneration, bulging discs, narrowing, wear and tear, and suddenly the conversation turns into hardware, screws, rods, and fusion. And here is the problem. Many older adults hear that plan and imagine that the surgery will restore the back they had 20 years ago. It often does not. Spinal fusion is a major operation. It can mean long anesthesia time, substantial pain afterward, limited mobility, blood clots, infection risk, and a recovery that demands more physical reserve than many seniors have. And even when the surgery goes well, it may shift stress onto other parts of the spine, creating new problems later. Some seniors truly need spine surgery. If there is severe nerve compression, loss of function, bowel or bladder problems, or rapidly worsening weakness, that is a different conversation. But for chronic wear and tear back pain, seniors should be extremely cautious before agreeing to aggressive fusion surgery. Because the question is not, can we operate on the spine? The question is, will this actually improve your life enough to justify the risk? For many seniors, the better path may be targeted physical therapy, posture correction, core strengthening, weight management, pain procedures, nerve treatments, or less invasive approaches first. If surgery is presented to you as the only answer for long-standing back pain, slow the conversation down immediately. Ask this: what are the non-surgical options, and what happens if I try those first? Sometimes the most dangerous surgery is the one that was never truly necessary. Surgery number 3, massive cancer surgery in a body that is already running on empty. This one is emotional, because the moment people hear the word cancer, panic takes over. Cut it out, get it out, do something now. That instinct is deeply human, but not every operation that removes a tumor improves a senior's real outcome. And that is one of the hardest truths in medicine. There are cancer surgeries that are long, brutal, and physically draining even for younger patients. They can involve multiple organs, long hospital stays, feeding issues, infection risk, loss of strength, and prolonged rehabilitation. In a strong patient, those risks may be worth it. In a frail senior with heart disease, poor nutrition, kidney problems, lung disease, or advanced weakness, the surgery itself can become the event that breaks the body. That does not mean surgery is wrong. It means the goal has to be bigger than just removing the cancer. The real goal is more good life, more meaningful time, more comfort, more function, more time that still feels like life. If a senior is being offered a major cancer operation, one of the most important questions to ask is this: will this treatment help me live better, or will it only make me suffer longer? That is not a negative question. That is a wise question, because in some situations, less aggressive treatment, targeted therapy, symptom control, radiation, or careful monitoring may align much better with the person's actual health, values, and priorities. No senior should ever be shamed into a huge cancer surgery without a real conversation about what recovery looks like, what life may look like afterward, and whether the body is strong enough to benefit from what the surgeon is trying to accomplish. Surgery number 4, elective joint replacement when the rest of the body is not ready. Hip and knee replacements can be extraordinary. For the right person, they can restore movement, reduce pain, and give someone their life back. But the phrase elective surgery matters more than most people realize. Elective means you usually have time to prepare, time to optimize your health, time to ask whether this is the right moment, not just the right procedure. Because when a senior has uncontrolled diabetes, unstable heart issues, severe obesity, serious lung disease, poor circulation, or general weakness, even a very common joint replacement can become much riskier than people expect. The operation may be routine for the hospital. It is not routine for your body. The real danger is that people hear how common these surgeries are and assume they are automatically low risk. But common does not mean harmless. Not for every patient. Clots can happen. Pneumonia can happen. Infections can happen. Delirium can happen. long immobility can happen. And if the person was already weak going in, the recovery can become the very thing that steals the independence they were trying to preserve. That is why seniors should never agree to a hip or knee replacement without asking, is my body truly prepared for this right now? Not emotionally ready, not tired of the pain, physically prepared. Have you built up your strength? Is your blood sugar under control? Is your blood pressure stable? Have you improved your nutrition? Have you talked about pre-surgery conditioning? Have you planned the first days and weeks after coming home? Sometimes the best decision is not no. Sometimes the best decision is not yet. And that one difference can save a senior from a recovery they were never built to handle. Surgery number 5, emergency abdominal surgery without a clear understanding of likely outcome. This one is different because nobody schedules an emergency. A blocked bowel, a perforation, internal bleeding, a sudden abdominal crisis. These things happen fast, and when they happen, families are terrified. Everyone is exhausted. Everyone wants a miracle. And in that moment, surgery can feel like the only moral choice. But here is the truth. Families need to hear before they are ever standing in that hallway. Emergency abdominal surgery in a frail senior can be one of the hardest recoveries in all of medicine. Why? Because there is no preparation time. No chance to build strength, no chance to optimize medications, no chance to improve nutrition or stabilize other conditions first. The body is hit while already under stress, often with dehydration, infection, inflammation, low blood pressure, or organ strain already in motion. That combination can be devastating. And this is exactly why seniors and families need to talk early, before any emergency happens, about values and goals. If a severe emergency occurs, what matters most? More time at any cost? Preserving mental clarity? Avoiding a prolonged ICU stay? Maintaining independence if possible? These are not dark conversations. They are loving conversations. Because when families have never discussed these things, they are forced to make life-changing decisions in panic, guilt, and confusion. And that is a terrible way to choose. If you are over 60, do not wait until the middle of the night in an emergency room to begin talking about what kind of treatment you would or would not want. Now, we have covered the 5 surgeries, but the most important part of this conversation is not fear. It is what to do with the information. Because if all this gives you is anxiety, then it has not helped you. So let me give you the 4 questions every senior should ask before agreeing to any major surgery. Question 1. What happens if I do nothing for now? That question is powerful because it reveals whether the situation is truly urgent or just being presented with urgency. If the answer is that nothing dangerous is likely to happen immediately, then you have time. Time to think. Time to gather records. Time to strengthen your body. Time to get another opinion. Question 2. Is there a less invasive option? Maybe there is. Maybe there is not. But if you never ask, you may never hear about the alternative that carries less pain, less downtime, less blood loss, less confusion, and less damage to your independence. Question 3. What does recovery really look like for someone like me? Not the average patient, not the healthy 62-year-old on the brochure. You, your age, your medications, your heart, your lungs, your kidneys, your memory, your home setup, your support system. If the recovery conversation stays vague, that is a warning sign. Question 4. What am I most likely to be like 3 months after this surgery? That question forces the discussion out of the operating room and into real life. Will you be walking? Will you need help bathing? Will you be in rehab? Will you still be driving? Will you be mentally sharp? Will you be back in the hospital? A surgery should never be sold only on what happens in the operating room. It should be judged by what happens after. And now I want to tell you something many seniors are never told. If you do decide to have surgery, what you do in the weeks before, it matters far more than most people realize. You can actually change your odds. If your procedure is planned, use the time. Walk every day if you can. Build leg strength. Build lung strength. Eat enough protein. Correct dehydration. Improve sleep. Stop smoking if you smoke. Review every medication and supplement. Ask whether anemia, malnutrition, poor blood sugar control, or weakness can be improved before surgery. A prepared body and an unprepared body do not experience surgery the same way. That is not motivational talk. That is reality. And here is another thing that matters. Never go to a major surgical consultation alone. Bring someone with you. Because the moment people hear words like cancer, blockage, rupture, surgery, or urgent, their brain narrows. Fear takes over. They stop hearing details. They nod, but later they can barely repeat what was said. That is normal. So bring a calm second set of ears. Someone who can take notes. Someone who can remember the questions. Someone who can say, "Wait a minute, can you explain that again?" That one decision can protect you from making the biggest medical choice of your life in a mental fog. Now let me give you 5 red flags that should make any senior slow down before agreeing to surgery. Red flag number 1, you are being rushed for an elective procedure. If it is not a true emergency, you deserve time. Red flag number 2, surgery is presented as the only option from the very first visit. That does not automatically mean it is wrong, but it does mean the conversation may be incomplete. Red flag number 3, nobody clearly explains what happens if you wait. Doing nothing for now is still a medical option, and sometimes it is the smartest one. Red flag number 4, your hard questions seem to irritate the room. A good surgeon does not get offended by informed questions. A good surgeon respects them. And red flag number 5, recovery is described with cheerful vagueness. You'll be fine. You'll bounce back. You'll be up in no time. That is not a plan. That is a slogan. You deserve details. Now I also want to say this carefully. This is not about attacking surgeons. Most surgeons work incredibly hard, and many save lives every single day. But the medical system is often built around action, around procedures, around moving quickly, around solving a visible problem. And sometimes what gets lost in that system is the deeper question: is this operation truly right for this specific older body, at this specific time, with this specific level of reserve? That is the question wise seniors ask, and I want to leave you with something hopeful. Avoiding the wrong surgery is not the same thing as giving up. In many cases, seniors today have more options than ever before: better medications, better pain management, better physical therapy, better minimally invasive procedures, better rehabilitation, better ways to buy time, better ways to preserve function, better ways to support the body instead of overwhelming it. Sometimes the smartest care is aggressive treatment. Sometimes the smartest care is a smaller intervention. And sometimes the smartest care is stepping back and refusing to let fear make the decision for you. Here is the one sentence I want you to remember from this entire video. A surgical recommendation is not a command. It is the beginning of a conversation. You are allowed to ask for time. You are allowed to ask for options. You are allowed to ask what happens if you wait. You are allowed to ask how this affects your independence. You are allowed to get a second opinion. You are allowed to say, "I am not ready to agree to this yet." That is not being difficult. That is being responsible. So let's bring it all together. The 5 surgeries many seniors should never agree to without extreme caution are these: open heart surgery in a frail body when less invasive options may exist, multi-level spinal fusion for chronic back pain, massive cancer surgery when the body may be too weak to benefit from it, elective joint replacement when other health problems are not under control, and emergency abdominal surgery without earlier conversations about goals, values, and likely outcomes. The message is not avoid all surgery. The message is this: do not confuse an available surgery with a necessary one. Do not confuse a technically successful operation with a good outcome. And do not confuse pressure with urgency. Ask the harder questions. Protect your strength. Protect your mind. Protect your independence. Because at this stage of life, that matters more than most people are ever told. If this message helped you, write this in the comments. I will ask more questions. Share this with a parent, a spouse, a friend, or anyone over 60 who may one day be told, This needs to be done right away. And if you want more honest health guidance designed to help you stay strong, informed, and independent, subscribe to Wellness Daily. Take care of yourself, stay calm, stay curious. And remember, the final decision about your body should never be made by fear alone. And one last important note, everything I shared today is general educational information. Every person's medical situation is different, and any decision about surgery should be made with your own doctor or specialist, based on your history, your condition, and your personal goals.